Hello, the School Community Partnership for Mental Health program, known as Scpmh, is a school-based mental wellness model for collaboration between schools, students, parents, and community mental health providers. The partnership provides mental health resources to students and families who otherwise would not have access to mental health services. The community mental health clinicians come right into our Milwaukee schools to provide therapy to our students, workshops to families on mental fitness, and programming to our teachers on mental health. Service delivery focuses on students with emerging or unmet mental health concerns that extend beyond what can be addressed by school support staff. The model seeks to increase access to early, targeted interventions in the school, prevent more costly care, decrease school suspensions, truancy, and/or adjudication. In Milwaukee, access to quality mental health services for youth is problematic and a significant barrier. What is the mental health reality faced by today's youth? 1 in 6 youth in the United States aged 6 to 17 experience a significant mental health disorder. However, only about 40% of those youth receive treatment, and that number is estimated to be less in the urban setting. In Milwaukee, access to quality mental health services for youth is problematic and a significant barrier. During the 2020-21 school year, COVID-19 had a significant impact on Milwaukee Public Schools, as well as the Scpmh partnership itself. In 2020-21, the Scpmh model operated in 23 schools. Mental health services from our partnership agencies were mostly offered virtually. From those Scpmh schools, there were 371 referrals for students with unmet or emergent mental health concerns. Of those referrals, 63% or 235 of those families received a mental health consultation, and 41% or 153 of the referred students received therapy service via Scpmh clinicians. During the 2021-22 school year, the Scpmh model has expanded to include 6 community mental health partners providing services within 38 schools. Yet we have a long way to go in ensuring all of the students in our over 150 schools have access to these types of services. The 6 current Scpmh community mental health providers are Amri Counseling Services, LLC, Children's Wisconsin, Lutheran Social Services of Wisconsin and Upper Michigan, Incorporated, Mental Health America of Wisconsin, Sebastian Family Psychology Practice, LLC, and the 16th Street Community Health Centers. Our data is telling us that students who receive therapy services with the Scpmh program show improved mental health, improved school attendance, decreased office referrals, decreased suspension, and significant improvement in academic achievement. But the impacts of Scpmh go far beyond that, as we will hear from 2 principals with our Scpmh schools.
When we talk about mental health, that is such a broad field. Students have always had mental health issues. I think the big difference is what is causing the mental health issues now compared to 20 years ago, and the percentage of students who have mental health issues now. I think the biggest thing we look at is trauma when we talk about mental health, because it's more frequent and it's growing rapidly. We have students who are struggling with ADHD, ODD, oppositional defiance disorder. Those are things we've kind of seen for years and years. But the trauma piece is the one that seems to be growing astronomically amongst our students. If a child is experiencing some level of trauma, a lot of times it's a safety issue. They're scared, they're uncomfortable, they're not certain where they belong or how long it's going to last.
Just given everything that's going on right now, from navigating COVID to the protest that's happening right now, particularly with Black families and families of color. Mental health is critical, and we've established that racism is a mental health issue. And so, thinking about my kids here, where 50% of them are African American, it's a real need. How do we navigate those issues? So I think having a resource like Scpmh allows us to know that we have a go-to, experts in the field, a coalition, a team of folks that can come in and support our kids that have very specific needs, very high-level needs.
Scpmh is a huge part because they offer services that we cannot, but the connector is that the school, the mental health, and the family are all working together. Where if a parent were to take their child outside of the school to get services, we may not necessarily be able to engage with the mental health professional. But with that mental health professional coming to us and the parent giving us the release to say, yes, you can engage about my child, we now get to work with the whole child. Bethune itself is servicing nearly 50 students in a school year who have some type of trauma that they've been exposed to, where the counselors come in and work with them. And it becomes an amazing thing to see how a team of people can help a child who's in such need. And you can see the significant differences. And we are meeting the whole child where they need to be met.
Our kids do better academically, our kids do better social-emotionally, and then our kids also feel a stronger connection to their school because they see it as a place that they're getting their actual needs met. To me, it's just, you can't say enough about it. It's phenomenal. It's definitely needed.
And with Scpmh, they extend their support to our staff. So they're not only picking up on what our students need, they're also supporting our staff with understanding the students, how to get to a child's inner thought to get them to let it go for a little while. Let them know, I'm not dismissing it. If you can do that, you can work miracles with what they learn. But you have to recognize that distraction is real. And when your distraction is hunger, homelessness, abuse, neglect, I'm not really that interested in what 2 + 2 is. I'm not that interested when I'm not sure if I'm going to eat dinner tonight, if my mom is going to be okay because of who's living in our house. Those become real. I definitely can say we've seen students grow. We've seen students who would have tantrums, crawl under tables, throw fits, lock themselves in a locker. I mean, you name it, we've seen it. And some of those very students who have been involved with the Scpmh program no longer are locking themselves in lockers. They're not running out the building. They're able to better express their words. A lot of times there's a stigma that goes along with needing mental health assistance. If I do admit that I need mental health assistance of some kind, then something is just inherently not right with me, which is not the case. If our knee went out, we wouldn't hesitate to go get assistance for our knee so that we could get around better. If, we were having pain in our back, we would go to a doctor and say, hey, I want to be able to sit up straight. But something about the mind gives us pause for assistance. We struggle with the idea that it's okay. But when the students are able to get that support at the school, I think it takes away a large part of that stigma because it's within an area that they're normally in already. So they don't have to leave here and get in the car and know that they're going to this doctor's office to talk about what's wrong. They're coming to school like any other day, and for 30, 45 minutes of that day, they get to talk about it and go back and join their class without anybody ever really knowing what's going on. If the mental health providers are communicating with the school is communicating with the family, then the family is feeling supported.
A program like Scpmh allows us to service at the school level, but also bring in other experts that have those services and that can provide those services for our families right here at the school. And if other needs are identified, then we have those connections made and those networks established for our families as well.
Being in schools that never had this program and now being in a school that has it, I can't imagine going to a school that doesn't. It's unmeasurable. And so when they can find that, and they can find it in someone who allows them to talk about whatever they need to without that judgment, it's powerful. It is so powerful. Without the funding, without the program, we automatically begin to fail the children who need it the most. If we just take a look at what's going on around us every day, what things are students dealing with? What are they going to have to deal with that they may not have the skill set to handle if we take away programs such as this?
So if folks are thinking about, why do we fund this? Because we're gonna have better human beings, we're gonna have a better workforce. And this has been a resource that for a number of our students has made all the difference. And a lot of times it can be the difference between life and death. We're gonna have to navigate manifestations of mental health issues in some way, shape, or form if we're reactive. And this is an opportunity for us to be proactive.
If we allow our children to not get help or support because parents are not able to find it or get to it, or they don't know how to, or they're afraid of a stigma because somebody in the family will figure out that's where they're going on Tuesdays, then we owe it to our family, we owe it to our community, and we owe it to the future of our city to support these children so that they can grow up to become as positive and as self-regulated as possible, so that they can be as successful as possible.
The Scpmh partnership model relies heavily on the community mental health provider becoming an embedded member of the school community. This means that they provide services beyond what can be billed to insurance or through Medicaid, such as participating in parent-teacher conferences or at other school-wide events, as well as providing workshops and consultations to families and school staff. Continuing expanding the very successful Scpmh model to meet the needs of Milwaukee students requires a sustainable, comprehensive, school-based mental health funding structure for Wisconsin. Currently, the insurance gaps and unbillable services create hardships for our community mental health partners, as well as uncertainty for our partnership schools. Where can you help? To be direct, is your agency or your foundation positioned to make a multi-year commitment to funding Scpmh? The Scpmh partnership is looking for multi-year funding commitments of $20,000 per school per year. What does that funding support? A minimum of 2 days of therapy services at each school per week, which leads to increased access to early, targeted intervention in the schools that prevent more costly care as the teachers, parents, administration, school support staff, and community providers work collaboratively to provide consultation, therapy, resources, and monitor the student's progress. In addition, you would be funding mental fitness programming to increase families' and educators' awareness of mental health. Donations can be made on behalf of Scpmh to the MPS Foundation. Are you positioned to be able to advocate for a policy change in Wisconsin to a sustainable, comprehensive, school-based mental health funding structure? Current reimbursement for mental health services is less than the cost to providers. We recommend increase overall Medicaid reimbursement rates for school-based mental health services, expand the scope of what is reimbursable under Medicaid, including a continuum of support, align data collection to demonstrate the need and impact of school-based services. The Coalition for Expanding School-Based Mental Health in Wisconsin and WAFCA, the Wisconsin Association of Family and Children's Agencies, are two great resources to learn more about current policy changes in Wisconsin around school-based mental health. Thank you for spending a few minutes learning about the Scpmh partnership. The students, families, and schools in Milwaukee appreciate your commitment to ensuring access to school-based mental health supports. Again, if you are able to donate to Scpmh, please contact the MPS Foundation. Thank you.